So moving up with your MCQ discussion, we'll be discussing the next MCQ, which is the following is not a not a malabsorption syndrome. A Whipple's disease, celiac disease, C. tropical sprue, D. Stanges disease. Moving on with the first option, Whipple's disease, as we have elaborately discussed on our previous lectures on Whipple's disease. Whipple's disease is a part of malabsorption syndrome in which it is caused by Trophiema whippleyi. Trophiema. The word Trophiema itself says you it is a malabsorption in which trophy means nourishment and erema means barrier. There is nourishment barrier, taxes up barrier. So what are the important features in the diagnosis alone I will tell you. So we find there is flattened villi, okay, and there is has positive macrophages in lamina propria. This is your important diagnostic feature I want you to remember in Whipple's. Moving on to celiac disease, the same I have discussed in the previous videos also, how to differentiate between Whipple's and celiac. In celiac disease again, there is villus atrophy, whereas in your Whipple's there is only flattening of villi. Here the villus is atrophy, and another differentiating feature is there is crypt hyperplasia. These all your findings you see in your biopsies. Okay. I also told you how to do diffuse intestinal biopsy. Tropical sprue is another disease in which there is again malabsorption syndrome. Whereas your Tanges disease is not associated with any of the malabsorption syndrome. So that is your answer. So what is Tanges disease? Tanges is basically a defect in the ATP binding cascade protein. Acid transporter or protein ABC A3 defect. So what are the important features I want you to remember in Tanges disease is the striking feature is there is increased or hypertrophy of your tonsils. We call this as your orange tonsil, which has been asked in your MCQs previously. And the other two differentiating features of Tangiers I want you to remember is there is increased incidence of premature coronary artery disease and increased risk of stroke. So this is a picture showing you the orange tonsils in order to make you remember the points in Tangiers disease. So moving on to next MCQ, best test for small intestinal malabsorption of carbohydrate is your Xylose test. Okay, so we will be seeing in detail about the Xylose test. So what are the points I want to remember you in Xylose test is, okay, Xylose is a pentose which is brown in color, and what makes it brown is that old toluidine in the presence of acetic acid and heat. This complex formed is absorbed maximum absorption at 475 nanometer. Each of these points are MCQ for you. Okay. And again I want to remember this toluidine or toluene is also involved in your what cyclophosphamide causing hemorrhagic cystitis. Okay, remember this point also. Next, what happened is that if there is import absorption of the xylose, then it shows that there is some pathology with your villi, that is due to flattening of intestinal villi, as we have seen in pupils, and this results in abnormally low excretion, urinary excretion. In adults, the standard oral dose is 25 mg. In children, it is 5 gram, 25 gram, and in children, it is 5 gram. The urinary output during the next 5 hours is 5.8, and the normal urine output is 25% in children, which corresponds to that of 2 grams or 1.5 gram. Okay. So if there is abnormality in these Xylose tests, then we will go with small bowel biopsy. Again, I've told you. See, we have already discussed. In celiac disease, there is villus atrophy. In Weber's disease, there is flattening of villi. So automatically, there is going to be poor absorption of Xylose, and the urinary blood level excretion is also going to be decreased. So what happens in bacterial overgrowth syndrome is that there is abnormal granulous glucose, but it reverts normal to after your antibiotic therapy. So again, small bowel biopsy, we have already discussed focal biopsy and diffuse biopsy. So diffuse biopsy you do in cases of pupils, celiac disease, okay, and focal you do in cases of amyloidosis. Intestinal lymphomas, and Hodgkin's disease. Okay. So these are the points, important points, and already the asked MCQs in this topic. And Schilling's test, we have seen that in the last video, that it is used for diagnosis of pernicious anemia and B12 vitamin B12 deficiency, megaloblastic anemia. Okay, thank you.